Hi, and welcome to another presentation in my series, Medication Class, The Pivot Perspective.
Here is a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and the other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions.
Hello, my name is Dr. Amy Naparick. I am the founder and CEO of Pivot Integrative Consulting. I am a Doctor of Pharmacy graduate from Creighton University School of Pharmacy and Health Professions, licensed to practice in the Carolinas and Georgia. I'm proud to say that I recently became board certified in lifestyle medicine, and as a diplomate from the American College of Lifestyle Medicine, I'm excited to share this information with you. I am also an integrative pharmacy specialist, which just means I've been trained to look at health a little differently. I look for root causes of disease, which can stem from nutrient deficiencies, gut health, or imbalances within the body. I'm committed to evidence-based practice and lifelong learning. Because of this training, I am a pharmacist who loves to help people decrease reliance on prescription medications and use more natural things like food to heal their body. Today, we are going to talk about diuretics and micronutrient depletions. Our objectives today are to answer the following questions. What is blood pressure? What are diuretics and how do they work? What micronutrients can diuretics deplete? How can we use food to replenish these deficiencies? And where can you find more information?
Let's review the basics about blood pressure. When you have your blood pressure checked at your doctor's office or pharmacy, they give you a number like 120 over 80. But what do those numbers mean? Well, the heart has four chambers. The two on the top of the heart are called the atria, and the two on the bottom are called the ventricles. The ventricles are the powerful pumps that move the blood out of the heart and through the body. When measuring the blood pressure, the number on top is called the systolic blood pressure. This is the pressure to pump the blood out of the heart. The bottom number is the diastolic blood pressure, and this is when the ventricles of the heart are resting or filling. If the bottom number is high, that means there is an additional strain on the heart muscle in that brief moment when it is supposed to be at rest. According to the American College of Cardiology and American Heart Association hypertension guidelines, a normal blood pressure for an adult is less than 120 systolic and less than 80 diastolic. For elevated blood pressure, the systolic increases to 120 to 129, but diastolic is still less than 80. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic. And stage 2 hypertension is greater than 140 systolic or greater than 90 diastolic. A diagnosis of stage 1 or stage 2 hypertension cannot be made with just one blood pressure reading. Two blood pressure readings must show a high reading on two separate occasions in order to diagnose hypertension. It is a good idea to have your own blood pressure monitor at home and check it regularly. First, to ensure accuracy, make sure the cuff is the right size for you. A cuff that is too big or too small will not provide an accurate number. When checking the blood pressure, make sure you are in a seated position with feet on the floor and rest for about 5 minutes prior to taking the measurement. Place your arm, preferably the left, at the level of your heart or chest, and stay still and do not talk while measuring your blood pressure. Measure your blood pressure at the same time each day and keep a log. The best times are in the morning, right after you wake up, or in the evening, right before you go to bed. Let's talk about diuretics, otherwise known as the water pills. Diuretics work in the kidneys, which are located in the small of the back just below the rib cage. Kidneys are essential organs for the filtration of your blood. They work to decrease blood pressure by removing fluid from the system. If you think about the pipes in your house, less water equals less pressure, right? The same goes for your body. These medications work by making you pee a lot of fluid, which brings the blood pressure down. Because these medications will increase your trips to the restroom, it is recommended to take them first thing in the morning so they don't keep you up all night. This diagram is a closer look at a nephron, the filtration center of your kidneys. The purpose of the nephron is to filter out waste products and excess water from the body, as well as regulate the electrolyte balance in your bloodstream. The waste products form urine, which collects in the bladder. The diuretics work in various places in the nephron to reduce blood pressure by reducing the fluid volume in the bloodstream. Some electrolytes like potassium, sodium, and calcium can be depleted due to this fluid loss. The loop diuretics work here in the loop of Henle. Thiazide diuretics work here in the distal tubule. And the potassium-sparing diuretics work here in the collecting duct. The loop diuretics are furosemide, bumetanide, and torsemide. Here are the thiazide diuretics: chlorthalidone, hydrochlorothiazide, otherwise known as HCTZ, chlorothiazide, indapamide, and metolazone. The potassium-sparing diuretics are amiloride and triamterene, and those are also combined with hydrochlorothiazide. Like the category says, these keep potassium in the body rather than just peeing it out like some of the other diuretics can do. We also have the mineralocorticoid receptor antagonists, eplerenone and spironolactone. These are also potassium sparing. Now let's talk about some of the micronutrients that diuretic medications can deplete. Let's start with the loop diuretics, furosemide, torsemide, and bumetanide, because they can deplete many different micronutrients. Loop diuretics can deplete vitamin B1, vitamin B6, vitamin C, calcium, magnesium, potassium, sodium, and zinc. Keep in mind that while sodium may be depleted, there is usually plenty in the diet to replenish it, and it does not typically need supplementation. Vitamin B1, otherwise known as thiamine, helps with carbohydrate, protein, and fat metabolism. It helps form functional blood cells, works with the digestive functions, and normalizes heart function. It also helps with cognitive function and brain health. Vitamin B1 or thiamine deficiency can occur due to alcohol dependence, older age, because older people may find it difficult to prepare or eat a variety of nutritious foods. Also, in people with diets containing large amounts of white rice or processed grains, and possibly with those with eating disorders. A severe chronic thiamine deficiency is also known as beriberi. Early signs of thiamine deficiency can include loss of appetite, fatigue and irritability, and as the deficiency progresses, more severe life-threatening symptoms can occur. Heart changes can occur leading to heart failure. This is also known as wet beriberi. Dry beriberi occurs without heart failure, but can also include nerve damage, muscle weakness, tingling in the arms and legs, mental confusion, and blurry vision.
Some plant-based food sources of thiamine include oats, brown rice, asparagus, green peas, and potatoes. Animal-based sources include ham, pork, fish like salmon and trout, and duck.
Now let's take a look at vitamin B6, otherwise known as pyridoxine. Vitamin B6 is essential for protein metabolism. The amino acids, which are the building blocks of protein, are found in muscle tissue. The heart is one of our most important muscles in our body, so pyridoxine is essential for cardiovascular health. Vitamin B6 is also important for cognitive and immune function and is used to prevent nausea in pregnancy. People with a vitamin B6 deficiency can have microcytic anemia, which means the red blood cells are undersized. They can also have skin conditions, depression, confusion, and lowered immunity.
Some food sources of vitamin B6 include fish and organ meats. Plant-based sources are potatoes, chickpeas, avocado, sweet potatoes, bananas, and sunflower seeds.
Some of the functions of vitamin C include antioxidant and anti-inflammatory properties. Vitamin C also supports immune health, regulates gene expression, improves absorption of iron, and is necessary for collagen formation, which supports skin, bone, and muscle health. It also supports wound healing. A vitamin C deficiency is also known as scurvy. Some signs of scurvy include poor appetite and growth, impaired wound healing, painful swollen gums and tooth loss, impaired immunity, pain in the extremities, and skeletal muscle atrophy. It can also lead to an increase in capillary fragility and lots of bruising. Food sources for vitamin C include rose hips, guava, strawberries, citrus fruits, sweet peppers, parsley, kale, and broccoli. However, it is best to find fresh, local produce when you can, because vitamin C is fragile and starts to degrade right after picking, losing up to 50% of vitamin C content in a few days to a few months, depending on the food and storage conditions. More is actually lost during cooking, especially with boiling. Let's talk about some calcium. So, calcium is important for bone health, muscle health, blood clotting, nerve function, and thyroid function. A calcium deficiency can cause osteoporosis and brittle bones, poor dental health, cataracts, muscle cramps, weak and brittle nails, inflamed, itchy, and dry skin, as well as hair loss. Some foods that contain calcium include dairy products like yogurt, cheese, and milk, but there are also non-dairy sources as well. Leafy greens, tofu, and soybeans, fish that contain small bones like sardines or salmon, figs, and seeds like chia seeds also contain significant amounts of calcium. Here's magnesium. Magnesium is important for energy production, converting food to energy, and magnesium helps with muscle contraction and relaxation. Magnesium regulates neurotransmitters that send messages throughout the brain and the body. It also helps to form our genetic material, DNA and RNA, and regulates calcium to support bone structure. A magnesium deficiency may appear as fatigue, weakness, and loss of appetite, as well as nausea and vomiting. Someone with a magnesium deficiency may also experience muscle spasms or stiffness. Low magnesium levels may lead to an increase in blood pressure or blood glucose levels, brittle bones, and osteoporosis, as well as worsening migraine symptoms. Nuts and seeds like almonds and cashews, flax seeds and pumpkin seeds are a good source of magnesium. Legumes like black beans, edamame, peanuts, and lima beans contain magnesium as well. Then you also have quinoa, spinach, and dark chocolate. In fact, if you find yourself craving chocolate, you may be low in magnesium. Potassium, along with sodium, is important for maintaining proper fluid balance in the body. It is also important for muscle contractions, regulating digestion, transmitting nerve signals, and maintaining proper pulse rates. Signs of a potassium deficiency include weakness and fatigue, muscle cramps, digestive issues, abnormal heartbeat, tingling, and numbness. Some foods high in potassium include dried fruits like apricots, prunes, and raisins, as well as lentils, acorn squash, kidney beans, bananas, and fortified orange juice. Here's zinc. Zinc is great for our immune system by helping to produce antibodies. Zinc also helps our body with metabolism, wound healing, and our sense of taste and smell. Zinc also promotes cardiovascular health, so a depletion of zinc by diuretics can potentially raise blood pressure. Low zinc levels may lead to an increase in head colds and other respiratory infections, delayed wound healing, blurred vision, appetite changes, and unexplained weight loss, as well as mood changes such as irritability and depression. Low zinc can also manifest as hair loss, although too much zinc can also be just as bad. A person with a zinc deficiency may also have an altered sense of smell and taste, as well as brain fog.
Some foods that are high in zinc include animal-based foods like oysters, chicken, grass-fed dairy, and there are also plant-based options too, like cashews and almonds, spinach, asparagus, pumpkin seeds, and dark chocolate.
Now let's move on to the thiazide diuretics, chlorthalidone, HCTZ, chlorothiazide, indapamide, and metolazone. Thiazide diuretics can deplete coenzyme Q10, magnesium, potassium, sodium, and zinc. Again, sodium typically does not need to be supplemented, and magnesium, potassium, and zinc were covered under the loop diuretics. So let's look at coenzyme Q10. CoQ10 acts as an antioxidant and is critical for muscle health, and the heart is one of our most important muscles. So CoQ10 is needed to create energy in all of our body's cells. It can lower blood pressure, reduces platelet stickiness to discourage clots and strokes, provides immune and cognitive support. So, if CoQ10 can lower blood pressure and some blood pressure medication agents can deplete CoQ10, a supplement might be recommended. Remember to always talk to your healthcare provider or pharmacist before starting any supplements. Coenzyme Q10 deficiency can lead to physical and mental fatigue, difficulty concentrating, memory lapses, mild to moderate depression, and irritability. Chronic pain is also common with CoQ10 deficiency, with frequent headaches or migraines, muscle and joint pain, and an increased risk for developing fibromyalgia. Deficiency leads to a weakened immune system, which makes people more susceptible to cold and flu viruses and chronic dental infections. The increased inflammation that can come from a CoQ10 deficiency can lead to high blood pressure, high cholesterol, and heart failure. There are some foods available that contain CoQ10, but usually dietary sources are not enough to replenish a CoQ10 deficiency, possibly up to 30% of the recommended supplement amount. Also, some of these foods may not be as desirable, so a supplement may be recommended. The highest amounts appear in meats like organ meats, beef, pork, and chicken. Much smaller amounts, less than 1 milligram per serving, can be found in non-meat sources like soybeans, parsley, broccoli, sorrel, and sweet potato. The last group of diuretics is the potassium-sparing diuretics, amiloride and triamterene, and the mineral corticoid diuretics, eplerenone and spironolactone. As the name suggests, potassium-sparing diuretics do spare the potassium from being excreted and depleted, but folic acid, calcium, and zinc are not so lucky. Calcium and zinc were already covered, so let's talk about folic acid. Folic acid is key to healthy cell growth and function, the making of DNA and RNA, and is necessary for the formation of red blood cells. Folic acid is also part of the methylation pathway, which assists the body with detoxification. Folic acid reduces the risk for birth defects and preterm birth. A folic acid deficiency can show up as anemia, with weakness and fatigue. This anemia often goes hand in hand with vitamin B12 deficiency. In fact, folic acid supplementation can often disguise a vitamin B12 anemia. Folic acid deficiency also shows up as difficulty concentrating, irritability, and headaches. A person with a folic acid deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folic acid is part of the methylation pathway, which is part of our body's detoxification process. Changes to something called the MTHFR gene can inhibit the conversion of folic acid to its active form. This elevates homocysteine levels and increases systemic inflammation. Therefore, a folic acid deficiency can increase the risk of Alzheimer's disease and dementia, cardiovascular disease, and stroke or depression. There is also a higher risk for neural tube birth defects in women of childbearing age if they do not have enough folic acid. Some foods that are good sources of folate include legumes, which are beans, peas, and lentils, nuts, like almonds and walnuts, asparagus, eggs, leafy greens, citrus fruits, and the brassica family, like broccoli and Brussels sprouts. Now let's talk about some other foods and a dietary plan specifically for high blood pressure. Again, for blood pressure and nutrition, we need to unleash the power of vegetables by having at least half to three-fourths of your meal as vegetables. Pivot your mindset to focus on the vegetables first. Eat the rainbow. Choose a variety of vegetables in different colors. Utilize the DASH diet. More on this in a minute. Reduce consumption of flour, sugar, and processed foods. Remember, gluten can damage the intestinal barrier and cause leaky gut and systemic inflammation, which can cause damage to the blood vessels and the heart. Eating too much sugar can raise blood glucose levels, also damaging the blood vessels. Probiotics help to heal the gut and reduce systemic inflammation. Choose a quality probiotic to maintain balanced gut health. Also, incorporate more functional foods for heart health. Okay, well, let's talk more about that DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This is an eating plan based on research studies sponsored by the National Heart, Lung, and Blood Institute, and it is found to significantly reduce blood pressure.
The basic overview of the DASH diet includes eating vegetables, fruits, and whole grains, eating fat-free or low-fat dairy products, eating fish, poultry, beans, and nuts, limiting foods high in saturated fats like fatty meats, full-fat dairy, and certain oils, limiting sugar-sweetened beverages and other sweet treats, and limiting salt intake.
Based on a 2,000 calorie diet, DASH recommends 6 to 8 daily servings of whole grains, 6 or less servings of meat, poultry, or fish, 4 to 5 servings each of vegetables and fruit, 2 to 3 servings of low-fat or fat-free dairy, 2 to 3 servings of fats and oils, and less than 2,300 milligrams of salt. DASH also recommends 4 to 5 weekly servings of nuts, seeds, dry beans, and peas, and 5 or less weekly servings of sweets. Personally, I think eating 6 to 8 servings of vegetables and 4 to 5 servings of gluten-free whole grains is better for everyone's overall health, so I would actually swap those two. I'm also concerned about low-fat or fat-free products because they often substitute sugar for fat in order to preserve flavor. Fat carries a lot of flavor and is also good for the absorption of our fat-soluble vitamins A, D, E, and K. Balancing omega-3s with omega-6s provides many health benefits, such as cognitive support, cardiovascular health, reduced inflammation, bone and joint health, and healthy skin, just to name a few. So choosing the right kinds of fats is important. The DASH diet recommends vegetable oil, but you need to use caution here too. Soybean, canola, safflower, and sunflower oils can be highly unstable and inflammatory, as well as high in omega-6 fatty acids, which the standard American diet has in abundance. Olive oil and avocado oil are probably two of the best choices because they're rich in omega-3s. Nuts and seeds also contain omega-3 fatty acids to promote a healthy balance.
So remember to look for heart-healthy functional foods that contain omega-3 fatty acids like olive oil and avocado oil, vitamin D, magnesium, vitamin K and potassium, as well as coenzyme Q10 and folate. You should also look for nitrate-containing foods like cabbage, beets, and pomegranate, and seasonings like garlic, ginger, and turmeric. All of these are heart-healthy foods to include in your daily routine.
Here's a quick list of references for this presentation.
Thank you for watching this presentation in my series, Medication Class, The Pivot Perspective. I look forward to sharing more information with you in the future. Feel free to subscribe to my channel. If you're looking for more information on this topic or other topics now, you can check out my website, www.dramynaprick.com. I write a free weekly blog post on a variety of health and wellness topics. You can also follow my Facebook page or follow me on LinkedIn, Instagram, or Twitter. Thank you again, and remember, food is medicine.